This is case of the day, and today is the 105th case titled Epidural Fibrosis with Nerve Entrapment. And again, very sad moment. When I started preparing this about 45 minutes ago, I came to learn that Dr. Anita Borges passed away from an acute MI earlier today. She's been a great influence in my life, and a lot of the pathology that I've learned is because of her. She's always been a mentor, and it's really sad uh, to have someone pass away. So my condolences, and I'm sure your condolences as well. So this is a 41-year-old with multiple prior surgeries at other levels, had right S1 radiculopathy in earlier this year, so 9 months ago, and this is from scanned films, a large non-contained right posterolateral disc hernia with S1, S2 nerve compression. So that's L5S1. Microdiscectomy was done and then never completely recovered, but over the last 2 months has had radiating pain on the right going up to the grade 2. An examination showed S1 hypoesthesia of around 40%. So we did an MR, which I read today, and we can see that there's a little bit of a disc for sure, but there's some soft tissue here. And we can see obliteration of fat. So that's the left S1, that's the right S1, very indistinct on the T1. And the T1 can be very helpful in such situations. And on the T2, there is thickening of the nerve compared to the opposite side. Now, the contrast study shows abnormal enhancing soft tissue in the epidural space extending along the medial capsule of the facet joint, and the nerve stands out as a negative lesion here, and it's thickened. You can see that on the T2, and even here you can see that the enhancement is of the soft tissue and not really of the disc. And so while there's a little bit of residual disc material, the whole pathology is related to epidural fibrosis entrapping the right S1 nerve root. And while we didn't do an MR neurography and we don't do it routinely, this is the stir, and on the stir itself, this was at the same level. You can see that there's thickening and edema of the nerve. And if you put the post-contrast T2 and T1 together, you can appreciate it really well. And that's how you should read it. Have all of these images together on the workstation, synced, so that when you're moving or scrolling up and down, you're able to appreciate this. And it's the T1 that gives you a sense that something is seriously wrong here, because the fat is obliterated and there's an indistinct S1 nerve root. Then the T2 shows thickening, and then the post-contrast shows the thickened nerve and the surrounding fibrosis. So failed back is a term used when a patient's symptoms recur or there are new symptoms. These are the early causes, these are the late causes here, and today we focused on epidural fibrosis. But given the number of complications that we do see with the spine, I think I will, over the next year or two, whenever I see a case, just put it up here. Infection, of course, is very common, but so are other entities. There is surprisingly not much literature on this. So a lot of the stuff on use of contrast, differentiate disc from fibrosis was in the 90s and 2000s. And this is pretty much the latest article in 2020, and that's also 5 years old. And I think the only thing they say, apart from the fact that yes, a contrast study is very useful to differentiate epidural fibrosis from recurrent disc hernia, is that after 18 months post-op, it doesn't seem to help much or make a difference. So the whole idea of the paper was that, up to 18 months use it. After that, doesn't make much of a difference. So epidural fibrosis with nerve entrapment, a type of failed back, can be diagnosed easily with MR, especially if a contrast study is done, let's say up to 18 months post-op. The seminar WhatsApp channel. Thank you. And yeah, I'll see you next week now, I guess. But I'm going to be putting up a bunch of lectures that I'm giving on Saturday, and so they'll be up on YouTube anyway. Take care.